Workplace incivility and bullying is any negative behavior that demonstrates a lack of regard for others.
Bullying exists. Call it what it is. It can lead to a loss of valuable human capital and medical errors.
Hi, I'm Dr. Beth Bullock.
And I am Dr. Cole Edmondson. We are Robert Wood Johnson Executive Nurse Fellows and members of the project team which developed the Civility Toolkit, resources to empower healthcare leaders to identify, intervene, and prevent workplace bullying. This is the third video in a three-part series and follows video 2, in which we reviewed the 5-step approach to respectful conversations for difficult situations. In this third video, we will present 3 different vignettes and modeled responses using the 5 steps. In this first vignette, the setting is an intensive care unit. It is early in the morning and the nurses, students, and providers are all getting ready for the day. They each need to complete a physical assessment, gather data, and learn the events that occurred in the past 16 hours to share them during the interprofessional rounds later in the morning. Outside the patient's room, the patient's nurse is chatting with a colleague at the computer station. A medical student tentatively approaches and interrupts their conversation. He looks for the nurse's name, but her name tag is low on a lanyard and backwards, so he cannot see it.
Hi, is this a good time to assess Mr. Jones? I was assigned to him today.
Fine, but don't touch anything or wake him up. He hasn't slept all night and he just fell asleep.
The nurse continues to talk to her colleague, who calls her Kim, and then goes on into the next room to help her colleague turn a patient. The medical student washes his hands and his stethoscope. He approaches Mr. Jones' bed and first watches him breathe, looks at his monitor, and slowly looks over the entire bed. He then gently and very tentatively lifts Mr. Jones' gown to place his stethoscope and listen to the patient's heart and lungs. A monitor alarm goes off.
What did you do? I told you not to touch anything. Now you've done it.
I just wanted to listen to his heart and lungs. Is he okay?
Yes, he is okay. No thanks to you.
Have you ever witnessed something similar? It could have been with a medical student, as in our scenario, a nursing student, a new respiratory therapist, a radiology tech, or any other member of the team. Learners are especially vulnerable to incivility and bullying. They want to please, they want to be accepted as a member of the team, and they want to come away from the experience with many lessons learned and a new body of knowledge. By nature, though, they are being judged, and they are acutely aware of that. They want and need help, but often are not offered it by the more senior providers, in this scenario, the nurse. They are often initially shy with strangers and do not introduce themselves or seek introductions. Providers from outside a department, such as a radiology tech, are often intimidated by all of the technology and do not have collegial relationships with the unit staff. They feel like the outsiders. They don't want to cause any trouble, and they just want to obtain the radiograph and leave. They also want and need help, but often are not offered it by the more senior providers. What each of these groups have in common is a desire to do well, cause no harm, and be accepted as a member of the team. Yet, we often treat them as invisible until the monitor alarm goes off. Was the nurse being incivil? Let's look at the definition again. Workplace incivility and bullying is any negative behavior that demonstrates a lack of regard for others. In this scenario, we witnessed the nurse not offering help when it was clearly needed. The nurse knew that the medical student could not perform the morning assessment without touching the patient. So yes, she sabotaged the medical student's efforts. She demeaned him and intimidated him when she made her comments and when she rolled her eyes. So yes, this commonplace event was incivil.
Most providers experiencing incivility remain quiet and internalize their feelings. But over time, we know that human capital, the providers, and patient outcomes are affected. Let's presume the medical student learned to address incivility in the workplace from his medical school faculty and plans to have a respectful conversation with the nurse to discuss the event. Please use your 5-step pocket card as we move through the scenarios. It can be downloaded from the Courage bucket in the Civility Toolkit. There are 5 steps for respectful conversations for difficult situations. The first step is to plan for the conversation. Well thought out planning leads to conveying accurate information and creating an environment conducive to communication. In this scenario, the medical student knows that morning patient rounds will take at least 2 hours and cannot be interrupted for the conversation. He plans to have a conversation with the nurse after morning rounds and in an empty patient room to discuss the morning's event.
Kim, do you have a minute to talk? I'd like to talk to you about this morning.
Sure.
Let's go into this empty room so we can have some privacy and not be interrupted.
How you are perceived is more important than what you say. Regardless of the focus of the conversation, you want to be perceived as being a good listener, a team player, a person with the best intentions for everyone's safety, security, and well-being. And above all, you want to be perceived as respectful. So use the language of collaboration. You don't want to use words that invoke a negative response or are considered judgmental. You also do not want to use body language that is perceived as rude, inattentive, or closed off. Good listeners lean in slightly to the conversation. Employ the modified Center for Creative Leadership format: situation, background and behavior, and impact. In step 2, the med student will structure his comments using the first 2 elements: situation and background and behavior. For the situation, he will start the conversation with the reason for the meeting, be brief, then stop.
This morning at 6:30, I asked you if I could go in to assess Mr. Jones. You told me that I couldn't touch anything and not to wake him up, but you said that I could go in. Then you left. When I lifted his gown to listen to his heart and lungs, the alarm went off and you said that now I did it and that he was okay, no thanks to me.
Ask for the other person's perception of the event. What was the background and behavior to the situation from his or her perspective? Listen quietly, attentively. Only interrupt to check information or ask the other person to expand on a comment, to please tell you more. Letting the other person go first in the conversation opens communication and demonstrates respect for the other person's perspective.
Can you tell me more about this morning from your perspective?
Okay, but I'm not sure what you want to know. Mr. Jones is very ill and sensitive to stimulation. He had a difficult night, and I was being his advocate by keeping the lights down and keeping unnecessary stimulation away from him.
Can you tell me more regarding what is acceptable stimulation?
Mr. Jones needed to sleep. He is critically ill. The only stimulation that he should have is to check him if an alarm goes off. Otherwise, we bundle his care at prescribed times, for example, on the hour. You did your assessment at 6:30. Too many people are doing the same thing to him every day. It is just too stressful.
When the other person has completed his or her perspective, the med student will use the same structure for his comments, situation, and background and behavior. However, this time he will add impact, which is usually something related to building and sustaining human capital or patient outcomes. Repeat the situation and provide more detail.
This morning I asked you if I could go in to assess Mr. Jones. You told me that I couldn't touch anything and not to wake him up. Then you left. When I lifted his gown to listen to his heart and lungs, the alarm went off and you said, I told you not to touch anything.
Provide background and behavior that puts the situation into perspective.
This was my first day in the intensive care unit, and I never cared for a patient with so many lines before. I was very uncomfortable. The other med students told me not to worry, that the nurses would show me what to do and help me out. The senior resident told me that I had to complete my review of the overnight events and physical exam and report to her by 7. You didn't say that I couldn't do my assessment until 7 and that you were bundling his care and neither did the senior resident, so I didn't know. I didn't know that just lifting Mr. Jones' gown would make his blood pressure go down. I'm sorry.
He will describe the impact of the situation on building and sustaining human capital and/or impairing patient outcomes.
When Mr. Jones' blood pressure went down, I was so afraid that I did something horribly wrong. I was relieved when it came up right away. But I was also confused why you would let me go in to see him without giving me more information or helping me understand what would happen if I touched him. I know you were busy helping the other nurse, but I felt like I was a bother. I just want to do a good job, and I know that you have a lot you can teach me.
Pause. Let the other person gather his or her thoughts and respond. Listen attentively.
You are right. I should have told you that we were bundling his care and that I could go over his assessment with you closer to 7. I'm sorry you felt like you were a bother. I didn't mean that. I remember what it was like to be new. But I get frustrated too when people come up to me to touch my patient and don't even introduce themselves or ask me about my patient. You also didn't ask why I didn't want you to touch him.
Step 4. Empathize. This step is overarching throughout the conversation. Provide a gracious space and safe setting with good intentions and respect throughout the conversation. Be comfortable with pauses and silence, and truly listen. Be sensitive and straightforward. Put yourself in the other person's shoes. The last step is to summarize and plan for follow-up. Review the highlights of the conversation. Check for understanding that the summary is correct. Determine what is to follow before the meeting and review the plan.
This morning, I needed help, and it wasn't offered. I felt like I was a bother. But you explained the situation from your perspective, and now I realize that you were being your patient's advocate and that you really do care that I do a good job and will offer to help me in the future. I will also be more proactive and ask for help when I need it. I'm sorry that I didn't introduce myself or ask you more about Mr. Jones' night. You're right, that is important. I hadn't thought how disrespectful it was or how I missed key information by not asking you. I did look for your name on your name tag, but it was hanging low and facing backwards. Instead of waiting for the other nurse to call you by name, I should have just asked you what it was. Can we just start over?
Yes, that sounds like a good plan. I will introduce myself too when new people approach my patient and ask them if I want a patient summary. Yes, let's start over. Hi, I'm Kim.
The R in the mnemonic Be Aware and Care is for reflection. Take the time now to reflect on this scenario. Reflect on action, the past experience. Reflect in action, as an incident happens. And reflect for actions you may wish to take in future experiences. How could this situation have been averted? Could the med student have done anything differently? If so, what? Could the nurse have done anything differently? And if so, what? How else could the respectful conversation have been crafted? You likely thought of other things for the med student and the nurse to say. Please pause now for discussion.
In the second vignette, the setting is a college campus office. A course director, Professor Adams, is teaching an online course for 30 graduate students. There is a course syllabus and online materials that describe assignments, due dates for the assignments, and measurement criteria for a successful grade. A grading point is deducted per day for late work. One of the students, Ann Smith, is habitually late with her papers, and 1 point was deducted from each assignment with the reminders written on each paper to turn the next one in on time to avoid the deduction. The deductions resulted in her final grade dropping from an A to a B. It is the end of the term, and Ann saw that she was getting a B and contacted the course director.
I was supposed to get an A in research. You need to change it.
Written language is no less powerful than verbal or physical language and is more and more common due to email, electronic news, and social networking. Some might argue that it is more powerful because it can be forwarded and even broadcast internationally. So learning to respond respectfully in writing is just as important as learning to respond verbally. Workplace incivility and bullying is any negative behavior that demonstrates a lack of regard for other workers. In this scenario, we see a lack of respect for the role of the faculty. There is no salutation. The email starts out with a dictate to the course director demanding a specific course of action. The tone is hostile and implies that Dr. Adams made a mistake. While this first email does not directly match any of the examples on your screen, it is disrespectful and thus incivil. Had the student sent an email with a salutation and a paragraph crafted using the situation, background, and behavior and impact, the email would most likely not be perceived as incivil.
When subordinates or students are incivil or bullies, the dynamic becomes even more complex. Responses can be perceived as recriminatory. Therefore, the respectful approach is even more important. When the conversation is in writing, there is an opportunity to pause and reflect before replying. Remember, electronic media allows users to forward the conversation to anyone, anywhere, so this reflection is very important. In this scenario, Ann Smith tells Professor Adams that he must change her grade. Professor Adams gave her a grade consistent with the course requirements, which were met by all the other students. Let's presume that Professor Adams learned to respond to student incivility in the school, so he decides to try and respond respectfully. For step 1, Professor Adams reviews the students' papers, due dates, and dates turned in, and recalculates the grade, which remains the same.
Dear Anne, I received your email regarding your grade in the research course. Please tell me more regarding why you think your grade should be changed from a B to an A. Obviously, it concerns me that you think I made a mistake.
I think that I should get an A because my papers were good and met the criteria in the syllabus.
In a written conversation, it usually takes more interaction to unfold the story. Avoid the temptation to reply quickly. It is good to pause, reflect, and think through responses before sending. Model a respectful written dialogue.
Dear Anne, you are correct. Your written work demonstrated sound reasoning, and I wrote that in my comments. However, you did not turn in your papers at the assigned date and time. This was also part of the assignment criteria. Turning in your work late resulted in the grade point deductions described in the syllabus.
I am an adult learner and should be able to work at my own pace. For what I pay for tuition, there shouldn't be any arbitrary deadlines. You should just be concerned that I learn the material. It is illegal to give a lower grade because something is late. If my grade isn't changed, I will go to the dean.
Again, take the time to pause, reflect and think through the response before replying. Don't respond to charged comments. It gives them more power. Instead, model respect.
Dear Anne, this morning you contacted me requesting that I change your grade in the research course from a B to an A. You stated that you met all the course requirements and that when assignments are turned in should not be part of the grading criteria. And the first reason that it is important to get work in on time is so that it can be reviewed and returned in a timely manner. The faculty turnaround time of student work is tightly scheduled so that you can have all the feedback you need to work on your next assignment. The second reason it is important to get work in on time is because the learning content from each assignment is discussed in the online seminar each week following the assignment due date. The result of you turning in your papers late is that you had an unfair advantage compared to the other students. We were already discussing the material in seminar by the time you completed your papers and turned them in. It is extremely difficult to evaluate if you understand the material under those circumstances. I cannot identify what it is you're learning and what is taken from the online seminar. Because of this advantage, I took off 1 point for each paper that is late. This policy is listed in the syllabus. The only other option is to not accept late work and give students a 0 grade. However, then the learning for that topic cannot be measured at all, and your learning is too important to being successful in your new career.
To empathize, put yourself in the shoes of the student, your fellow faculty members, and the dean. The last step is to summarize and plan for follow-up. Review the highlights of the conversation. Check for understanding that the summary is correct. Determine what is to follow before the meeting and review the plan.
Anne, I know you are not satisfied with your grade, that you think it should be higher and no deduction taken for late work. So I shared your concerns with the dean. He asks that you please contact him. He is happy to meet with you to discuss your concerns.
Take the time now to reflect on this scenario. Reflect on action, the past experience. Reflect in action, as an incident happens, and reflect for actions you may wish to take in future experiences. How could this situation have been averted? Could the student have done anything differently? If so, what? Could the course director have done anything differently? If so, what? How else could the respectful conversation have been crafted? Pause now for discussion.
In this third vignette, there are 2 medical residents assigned to one unit, a nurse from another unit, and a visitor waiting for an elevator. One of the medical residents receives a page.
What is it?
I can't believe it. Mrs. Jones told the nurses that she wasn't told that her husband was having blood pressure problems. I just told her yesterday that his pressures were labile. Now Julie wants me to come back to the unit to talk to her. Why can't she just talk to her?
You're right. We have to tell families over and over again, and then they say we didn't tell them. Julie knows you just left the unit. Why didn't she talk to you before? It is frustrating. Are you going to go back to the unit now or wait until after lunch?
No, I can't. I have clinic all afternoon. Now I won't have time for lunch.
Here we witness the residents saying demeaning things regarding a family and the nursing staff. They also exhibited eye rolling, which displayed a lack of regard. So yes, it was disrespectful and incivil. In this scenario, Mrs. Jones and the unit's nurses were not directly impacted. They were unaware of the comments. However, the patient visitor and the nurse at the elevator, the bystanders, heard the comments. What do you think the visitor thought? Would he be willing to ask a question of his doctors next time? Would he think that they were talking about him behind his back or rolling their eyes at him when he wasn't looking? Would he wonder if the doctors think all patients are stupid? What about the nurse? What do you think he thought? Did he wonder what the residents say behind his back, or if they rolled their eyes at him when he called? Remember, bystanders can be other healthcare professionals, students, or the patients, families, and visitors in the setting. Bystanders can experience all the same negative effects as collaborators and need to see that the values of the organization are lived. So what do you do if you are the nurse who also overheard the conversation? You know this is a busy hallway and not a good place for a respectful conversation. You heard that the one resident will be tied up for the rest of the day, so it isn't a good time to talk. You also don't know these people. Do you let the topic drop because it takes too much effort to address it? Do you think to yourself that it isn't any of your business? Or do you plan to say something? Telling someone, for example, the medical residency director or the chief nursing officer, that someone he or she oversees did something disrespectful can be extremely difficult. There can be a power differential between the parties. The response can be defensiveness with closed communication. These are real issues that are often considered barriers and lead to complacency instead of action. Remember, most providers experiencing incivility remain quiet and internalize their feelings, but over time, we know that human capital and patient outcomes are affected. This nurse, though, decides to say something. Should he try to talk to the medical residents? Should he talk to his unit manager? Or should he talk to the director of the residency program?
Let's presume for this example that the entire organization practices the skill for respectful conversations. In this circumstance, the steps can be fluid among the participants. Let's see how this happens. For this scenario, the nurse goes to his unit director first, who then arranges for them to meet with the residency program director together. The unit director and the nurse should plan how the conversation will unfold and who will say what. In this scenario, though, the residency program director also knows the reason for the meeting, so will plan his part of the conversation too.
George, as I told you on the phone, we wanted to meet with you to discuss something that Ray witnessed outside the elevators on the 4th floor on Tuesday. It was regarding 2 residents talking about a patient. Ray was very concerned because a visitor overheard the conversation. I thought it best if we all met and you heard from Ray directly.
Of course, Anita. Ray, can you please tell me what happened?
Thank you, Dr. Kelly, for meeting with us. I didn't know who the residents were, so I went to Anita to ask what to do.
That's okay, Ray. It's really not a problem. I just want to know what happened so we can determine what needs to be done next.
On Tuesday, I was standing in front of the elevators on the 4th floor. I was on my way to lunch. 2 residents were there and an elderly visitor. One of the residents received a page about a Mrs. Jones. The nurse was asking him to come back to the unit to talk to her. I could tell that her husband was in the unit, and she had questions about his blood pressure. He told the other resident that he couldn't believe he had to go back. He had just spoken with her, and that the nurse should have handled it. And if he went back, it would mean that he would miss lunch.
So, Ray, can you tell me more? What about this incident really bothered you?
These residents were very condescending about Mrs. Jones. I heard the one say that he told her that her husband's blood pressure was labile. Maybe she didn't know what that meant. He rolled his eyes and made it seem like her questions were a bother and stupid. The visitor who was there just stood really still. I felt so bad for him. I wondered what he thought, but I didn't know what to say.
Was there anything else that bothered you?
Yes, Dr. Kelly. It really bothered me how they spoke about the nurse. They acted like she didn't know what she was doing.
Did you recognize the residents or the visitor?
No. I work in the nursery, and I think that they were from the adult floors. I am not sure if the visitor was a patient or not. I couldn't tell. Dr. Kelly, it really upset me when I heard the residents talking about Mrs. Jones and the nurse like that out in the hallway, where anyone could hear. It made me wonder if the residents on our floor talk like that about us too. I know that it can be frustrating to tell families things over and over, but when they are scared, they often don't understand, especially when we don't use lay language. I also understand that the residents have little time in a very structured day. We all need time for ourselves, so I know it is difficult to miss lunch. But it really bothers me that the visitor heard the residents talk about a nurse and another family like that. It didn't make our hospital look like a respectful healing environment for our patients and their families. I wonder what that visitor thought. Does he wonder if the doctors talk about him behind his back? Will he be willing to ask a question in the future? Maybe he won't, and because of that, his health suffers.
In this vignette, we see that Ray empathized with the residents and the visitor. Next, we will see that the residency director empathizes with Ray.
Ray, I appreciate you brought this to Anita's and my attention. I know it can be difficult to go to someone you don't know to talk about what someone else did. But this was important, and I'm glad that you did. The exchange you observed had a negative impact for the visitor, for you, and for Miss Jones and the floor nurse, who weren't even there. Building a culture of respect means that we have to live our values, and everyone is empowered to make a difference. This is what I'm going to do. I should be able to determine who the residents were based on the descriptions you gave me, the day, who was going to the clinic that afternoon, and the patient's name. I'll have a conversation with them, explain the situation, find out that from their perspectives what occurred, and then help them to realize the impact of their behavior. I suspect that I will find out they didn't mean to come off that way, and will be surprised that they did. They will be even more surprised that something they said could upset a visitor. Most people don't wake up in the morning thinking, who can I talk about today, or who can I be mean to? Most people do or say stupid things, not realizing how hurtful they can be. I often find that things like this, brought to their attention while at residency, become lasting memories. In fact, they become teachable moments for their own students someday. we need to take some time to think about how we can improve our visitor experience, and I'll talk to some of our colleagues.
Take the time now to reflect on this scenario. Reflect on action, the past experience. Reflect in action as an incident happens, and reflect for actions you may wish to take in future experiences. How could this situation have been averted? Could the residents have done anything differently? If so, what? Could the nurse have done anything differently? If so, what? What about the residency program director? How else could the respectful conversation have been crafted? By Ray, by George.
Emotions and tension can often run high with the increasing acuity of many settings and the numerous stressors, especially for productivity that we all face in healthcare. How we handle situations defines who we are. We hope that this tool helps you respectfully approach conversations for difficult situations. In this third video, we modeled the 5-step approach to respectful conversation for difficult situations for hierarchical, reverse hierarchical, and for bystander incivility. The steps that we used were to plan for the conversation, check perception, deliver the message, empathize, summarize, and follow up. At the end of each vignette, we followed the be aware and care mnemonic and reflected on our actions. Now it is time to practice your own respectful conversations.
This tool, from the Courage Bucket of the Civility Toolkit, was designed by a Robert Wood Johnson Foundation Executive Nurse Fellows project team, the PACERS. We chose this acronym because we are passionate about creating an environment of respect and civilities in healthcare. The project team members are listed for you here in alphabetical order. Without the group's wisdom and passion, this tool would not be possible.